Hello, everyone. It's Dr. Manjiri Nadkarni, Ayurvedic MD, registered holistic nutritionist. Today's topic, we are going to discuss everything about breast health. So, today's topic is Breast Health 101. We are going to talk about the importance of breasts. We are going to discuss five essential strategies for breast wellness, and we are going to look at the Ayurvedic aspect of breast health as well. So, if you have any questions, you are most welcome to post those in the comments. If you are watching this live, just say a quick hi. And if you are not watching this live, you can always tag me and write your question, and I'll be back to answer the questions that you have. Right. So, October is the Breast Cancer Awareness Month, and that is why we are going to do this series. This is a super important topic in women's health that nobody really talks about. We all know about breast cancer. I'm sure there's nobody who has no idea what breast cancer is. At the same time, there is not much discussion about the preventative strategies. There is not much discussion about other aspects of your health that can have an influence on your breast health. So that is why I'm coming to you with this topic. I'll start with a disclaimer that I'm not a licensed allopathic medical doctor in USA or Canada, and this is not to diagnose you or provide you with medical advice. This is to empower you with knowledge. This is to give you an understanding of the holistic aspects of your breast health, so that you can be empowered and take responsibility for your own health and focus on the preventative strategies of the health, right? So let's get started with breast health. So from a modern perspective, when we talk about breasts, we are going to look at the anatomy, the function of the breast tissue, but from a holistic perspective, you are looking at breasts from an emotional perspective as well, a mental emotional perspective, which will often reflect any changes that you go through your emotions. A lot of stress will precipitate as different symptoms in terms of your breast health. When we talk about breast, we talk about it as a sign of confidence, beauty. There are so many associations attached to it, especially as a woman. A lot of your confidence can be derived from it. These are the organs that nurture young ones, so they're also connected with your nurturing ability, but at the same time they have deeper connections within different systems of your body. So when we talk about the anatomy of the breast, we are going to look at the structure. So there are going to be lobules, which are glands. There are ducts. There's the fatty tissue and the connective tissue that the breast is mainly made up of. And it also contains a rich supply of lymphatics. There are blood vessels, nerves, but also a lot of lymphatics. And these lymphatics are often the key when it comes to prevention as well as protection of your breasts. These lymph nodes, a lot of them are located especially in the underarm and the chest area, and they drain excess fluid. They protect your body from different kinds of breast related conditions and are extremely important. While the primary function of breast is lactation to deliver, to produce and deliver milk to the newborn, it is something that is also very commonly connected to any of the hormonal changes in the body. So the women's hormones, estrogen, progesterone, two main female hormones, are going to have a huge impact on your breast health. And when we talk about different breast conditions, especially, if you're looking at fibrocystic breast disease, which is also very common, it is a benign condition where there are going to be cystic, painful breasts. You can have lumpy breast, you can have dense breast, and a lot of these are caused by an excess of estrogen and a lowered level of progesterone when it comes to your breast health, right? So it is super important to identify that if your breast is undergoing any changes, if they are getting lumpier, if they are getting painful, if you are seeing any nodules, 100% get it checked by your primary healthcare practitioner. and also request to get your hormones assessed. Do not look at your breast health from a solitary perspective that, oh, something's going on with the breast. It could be a result of the hormonal changes that you are undergoing through, right? And throughout a woman's life, your breasts are not going to stay the same. So again, your breast tissue is very sensitive to hormones. As your hormones change, your breast is going to change. As your nutrition status changes, because it's such a huge deposit of fatty tissue, and fats can be healthy or fats can be extremely inflammatory. So if you are ingesting a lot of seed oils, a lot of omega 6 fatty acids, which are found in oils like canola oil or the cheap margarines, etc., you are not going to have a healthy breast tissue. So puberty is when the breast development will start, the breast enlargement will start. Menstrual cycles will often create a lot of changes. If you are somebody who undergoes a lot of breast tenderness during PMS, or your breasts feel extremely swollen during PMS, they're painful, they are very irritated. If you experience any redness, getting your hormones checked is super important. Again, they will undergo changes in pregnancy and lactation to be able to produce milk under the influence of the hormone prolactin. And as you undergo menopause, they will lose a lot of the fatty tissue, as well as the connective tissue can get depleted. And what ends up happening is you may experience a little bit of sagging, also because of certain hormonal changes, certain nutritional changes, dietary changes. Your digestive capacity is reduced. You are also more prone to developing various risks like that of breast cancer as you age. Right. So these are a little modern perspectives on breast health. Now let's look at the Ayurvedic aspect of maintaining healthy breasts. From an Ayurvedic perspective, we call them Stanyavaha Srotas. So the channels, they are the sites of Stanyavaha Srotas. So these are channels that are responsible for production of milk, and these are channels, also micro channels. And whenever we talk about a channel, there is always a tendency to get blockages, right? So that is why it's extremely important to incorporate daily movement, daily exercise, so your lymphatics are draining well and these channels are not getting blocked. From an Ayurvedic perspective, breast tissue is connected to Rasadhatu. Stanya is an Upadhatu of Rasadhatu. So, breast tissue is directly connected to Rasadhatu. And this is where there is another correlation of the lymph and lymphatic channels. And this is also why not having a lot of stagnation in the body in the form of ama becomes important for your breast health, because these are located in the site of the chest near your lungs. They are also the site of prana, vata, and prana is one of the five types of vata dosha that is connected with your mind and emotions, right? So it has the responsibility of being connected with your sensory organs. So any perception, any fluctuations in the mind, so the senses will bring in all the good and the bad. And if you are going through a lot of stress, if you're seeing terrible things happening, if you are experiencing emotionally a lot of stress, that is going to have a direct impact on the health of your breast, because your prana vata gets aggravated and it's going to show up in terms of your breast health as well. In terms of doshas, we've talked about pranavata, but because breasts are associated with fatty tissue or medha dhatu in Ayurveda, Kapha dosha is the main dosha involved. And here it is important to not have a lot of stagnation. If you're experiencing swollen breasts, if you're experiencing very heavy breast, very painful breasts, you have to look at Kapha dosha. Is there any stagnation? How is the movement? And here is where massages, lymphatic massages, dry brushing can be extremely important aspect of your breast health. So we have covered the basis of Ayurveda from a breast perspective. Um, as we age, since we are a child and as we start aging, Our body will undergo natural transitions, and the doshas are changing as well depending on your life stage, on your age. Puberty is dominant in kapha dosha, so that's where the growth of the breast tissue will take place. Um, pitta is the middle ages. If you are undergoing a lot of stress, if you are undergoing a lot of dietary changes, if you are having a lot of fiery fermented foods, that can aggravate your pitta dosha, and that can also lead to conditions like mastitis or any inflammation of the breasts. And naturally, when you undergo menopause, vata dosha takes dominance, and that's where you will notice that the perkiness of the breasts is not there. They may start sagging. There may be loss of fatty tissue. There may be some dryness, some pain associated. So these can be certain changes that you can undergo in terms of your breast health. Any sign of pain, any sign of lumps, any inversion of the nipples, or any, if you're seeing any blotches, it is always a great thing to get assessed by your primary healthcare provider, to get regular breast examinations, to examine your own breast on a regular basis, and also get them from a healthcare professional. When we look at different doshas, they are going to affect your breasts in different ways. So, if vata aggravation happens, if somebody loses a lot of weight, you will see that your breast can actually shrink because of the loss of fatty tissue. There can be a lot of dehydration, but there can also be blockages to the channels. If there is a lot of pitta aggravation, pitta aggravating diet, lots of alcohol, kombuchas, fermented foods, as I was discussing, it may lead to a lot of abscesses or infections or lots of redness, inflammation. Sometimes pus discharge can happen as well, or there can be a lot of pain and tenderness associated. And if you are having a diet that is extremely heavy, extremely dense, kapha aggravating, you're not exercising, you're not moving at all, it can create a lot of lumpiness, it can create swelling, it can create any kind of yeast infection under the breasts as well, or a very thick, oily discharge at times as well. So, these are certain factors about your breast health that you need to be aware of from a doshic perspective. Now, as I was saying, your emotions are closely connected to your breasts. And if you are undergoing any changes in the breasts, if they are painful, if they are lumpy, if there is any cyst formation, always seek help, always talk to a professional to see what is required from the next five essential factors that you need to change for the health of your breast. And also get support with your emotional aspect. Try to identify what's going on in your life that is reflecting on your breasts, and this is extremely important. We are discussing everything in relation to breast cancer, especially next session onwards. But and it is important to know that breasts are not only important in women but also in men, right? So breast cancer can happen in men too. 1 in 100 cases of breast cancer are usually men. So it is important to have that connection, have that emotional connection, have that understanding of what's really going on in your body, any kind of changes happening in your body for both men and women. And now let's talk about the five essential factors to prevent breast cancer. So, this is extremely crucial. The number one is always diet and lifestyle. So, in Ayurveda, we talk about ahara and vihara. Ahara is the diet that you consume, not just from your mouth, but your mind as well, through your senses as well, right? So, what are you consuming? In terms of food, there are several foods that you can start adding to your diet which can support prevention of breast cancer. There are certain foods that will detoxify the excess estrogens that is the main culprit in various pathological states of breast cancer, right? So foods like cruciferous vegetables, broccoli, kale, cauliflower, so we are going to discuss that in the next sessions. So those are extremely potent at helping detoxify estrogen. So that's one aspect. But on the other hand, if you're having a diet that is processed, if you're having a diet that's laden with pesticides, if you're having a diet where you are eating a lot of canned foods, and there is BPA in the lining of the can, that is going to work as a hormone disruptor, that is going to increase your risk for breast cancer. All the chemicals, whether you put chemicals in your body through your diet or through the lifestyle or environmental toxins or even makeup, right? So that is why, even as women, I love my makeup, but it's important to find clean sources of makeup that are free from a lot of toxicity. And so you're not adding those excess of the hormones, estrogens, especially xenoestrogens, to your body. So diet, lifestyle are crucial aspects. Exercising, moving your body, making sure your lymphatics are moving well, they're getting well drained, is a super important aspect of preventing breast cancer, and that's my number one factor. Number second factor is achieving hormonal balance. So, hormonal balance is again crucial to your breast health and prevention of breast cancer. Often, changes in estrogen and progesterone, especially excess of the bad estrogens, there are xenoestrogens, foreign estrogens that can occupy the receptors of your natural estrogens and can have a hundredfold effect. So, what's that going to do? That's going to proliferate the tissue, that's going to create a growth in the tissue, that's going to create the tumors, and that's going to start the pathogenesis of breast cancer. So, extremely important to make sure your hormones are balanced. And this is true for both men and women, right? There are certain foods which have phytoestrogens, so plant based estrogens, that can help detoxify these xenoestrogens from the body. So, certain things like flaxseed, certain foods like mung beans are rich in phytoestrogens, and you could incorporate them to achieve hormonal balance. Hormones are a very tricky topic. A lot of them can be assessed through symptoms, to see what changes you're undergoing. And there are various hormonal tests available as well to be able to assess your hormones. And always look at hormones from a holistic perspective. So we cannot isolate estrogen and progesterone. We cannot isolate, your hormones. You have to look at what's happening in the entire body, because any changes in your insulin, for example, which is your blood sugar balancing hormone, will lead to a lot of deposition of fat in the body. And excess fat is going to now create more estrogenic effect in the body. So it's not just about estrogen, progesterone. You have to get your all hormones of the body in order, in able to stop the pathogenesis of breast cancer. I'm going to say a quick hi to Isha. Isha's here. Nice to see you. Anika's here. If you're watching this live, say a quick hi. I can see some viewers on Facebook as well as some on Instagram. We are talking about health, breast cancer prevention. We are discussing about the five essential factors for preventing breast cancer. We've talked a little bit about diet, lifestyle. We've talked a little bit about hormones. For the next four sessions, I'm going to cover each and every topic in depth, right? So I'm just taking, like, this is a superficial view to give you a little understanding. But next topics, we are going to go in depth in each and every topic. The third thing that's super important is detoxification. So you have to make sure that you are not taxing the systems of your detoxification. So your body detoxifies on a daily basis. That is what your body naturally does, right? It is you who, through diet, through lifestyle, is interfering with your body's natural detoxification. If you are eating a lot of foods that are laden with pesticide, foods that are laden with chemicals, if you are exhibiting signs of certain conditions like NAFLD, which is non alcoholic fatty liver disease, you can understand that your liver is overwhelmed and it is unable to detoxify the excess bad estrogens from the body. If you are taxing your kidneys, if you are taxing your lungs, if you are taxing your skin, your digestive tract, which will show up on the skin, you are not letting your body naturally detoxify. And if you are exposed to chemicals, either through your lungs, by breathing in chemicals, or by drinking water, which will gain access, contaminated water, water laden with pesticides, will gain access to your body. Oral contraceptives, hormone replacement therapy, right? So those are also list known as carcinogens. So this may be shocking for a lot of women, but if you look at probable carcinogens or the list of carcinogens, hormone replacement therapy as well as oral contraceptives, any kind of synthetic hormones are carcinogens, have been identified as carcinogens. Also, the drugs for breast cancer treatment are carcinogenic in nature, so it's like using poison to kill poison. But this is important to understand that, okay, if you are going through any kind of breast cancer therapy, if you have taken any of these medications, it's still important to support the channels of natural detoxification to prevent further recurrence, to prevent further complications, right? So detoxification, extremely, extremely, extremely important. Lymphatic flow is extremely important because you need movement to move your lymph channels. Lymph channels don't move by themselves, so every time you're exercising, moving your body, doing yogasanas, doing specific massages, or dry brushing, that's the time your lymphatics are going to move. And if you don't move your lymphatics, they are going to stagnate, and a lot of the toxins in them will get to stay inside, interact with the tissues, and then create tumor. So that is why lymphatic flow extremely important, to establish that lymphatic flow on a regular basis. So this was number 4. So detoxification, lymphatic flow, extremely important. Exercising on regular basis, yogasanas, even breathing deep, right? Opening your chest completely while you're breathing, and not just shallow breathing till your throat, right? Super, super, super important from a health perspective. And it is the last one is emotional health. Cancer as a disease is itself linked to a lot of emotional distress, right? Cancer is a multi factor, there can be multiple factors involved. And I'm taking actually a course in oncology nutrition. I'm on to my third course now. But what we see is there are 10 different factors that can create an impact on cancer, or that can contribute to cancer. Hormones, your emotions, everything, can play a part. And it is extremely important to achieve emotional balance, to achieve, you know, joy, and cultivate that happiness and cultivate that content in today's world where you are constantly running or chasing after one thing or the other, right? And any of the emotional issues, especially women who internalize a lot of things, can manifest in your body in the form of breast cancer or other kinds of cancers as well. And about 95% of cancers are actually preventable. So data has also shown that 95% of the cancers can be easily preventable. Your genes, some people blame it on the genes, but genetics is one part of the equation. Foods have capacity, your emotions have capacity, your lifestyle has capacity to switch on and off these genes, right? So this is where revamping your overall health, revamping your lifestyle, making sure you're following a diet, a lifestyle that's aligned with providing you years of joy by keeping your body healthy is extremely important, right? So these are 5 factors that we talk about when it comes to your breast health. I am doing sessions for this entire month. We are just talking about breast health, we are talking about breast cancer prevention. So every Wednesday I'll be right here. If you have any questions, you are free to post them as comments. And if you want me to talk about certain topics, please feel free to message me. Next session is going to be about understanding the connection between hormones and breast cancer. For October 16th, we will talk about reducing breast cancer risk through natural detoxification. October 23rd, we are going to talk about three daily practices to support your lymphatic system for breast cancer prevention. And October 30th, we are going to talk about five essential nutrients for breast cancer prevention. So, this is the perfect time to focus on your breast health. For those who follow the Vedic calendar and Vedic strategies, we are heading towards Navratri tomorrow. So, Navratri is the 9 nights of the goddess, where we honor, we worship the divine feminine. And she is the mother nature. She is Durga, the invincible goddess. She is the one who holds the strings to the entire universe and the mechanisms of the universe. And she's also, being a mother, she's very nurturing, right? And breasts itself are organs of nurturing. So take time this Navratri to strengthen your divine feminine, to reconnect with yourself, and to really support yourself the best that you can in terms of your health, to take charge of your health. In Ayurveda, we talk about four important things when it comes to health: maintenance of health, or preventing any disease, or mainly like reversing any disease. We talk about the chikitsa chatushpada primarily. In terms of treatments, we talk about the doctor, or the physician or the practitioner should be really knowledgeable, but the patient, the one who's undergoing condition, should be really strong mentally, physically, and should be able to do all the protocols, or be very proactive in taking charge of their health. Then we look at the support system, right, in forms of the paricharaka. So paricharak is nothing but your support system, is your family supporting you, or you have a good network of friends. If you're undergoing any kind of therapies, whether it's any treatments related to breast cancer or any other disease, how is your support system? And the fourth one, we look at it in terms of aushadhi, or any of the herbs, supplements, drugs, whatever it is, the device that's going to help you regain your health, right? So perfect treatment happens when all these four combine in a way that they are extremely, they're endowed with the perfect qualities of each, right? And I wanted to say this to remind you that you are a super important aspect of your own health, right? We often rely on others for our health. We rely on doctors. We will go to, do different tests. But every day you are putting in the food in your mouth, you are putting in the thoughts in your brain, or your mind, and those have the power to either make you healthy or make you diseased. So during this Navratri, please take time to contemplate on everything that you do. Are you honoring your inner goddess? Are you supporting yourself, or are you working against yourself? Right? So that's my talk for today. Here's where I am signing off from discussing about Breast Health 101, essential tips for maintaining breast wellness. Uh, Please share this with your friends, with your family. This is super important topic. If you are looking to work one on one with me, you can now schedule your 15-minute free consultation by clicking on the link with the write up on this video, and we can discuss the best way to make you healthy. Thank you for watching. Have a wonderful day, and best wishes for the upcoming Sharadiya Navratri. May the goddess be with you. May she support your journey, and may she support you to honor the divine feminine within you. Thank you for watching once again. Have a wonderful day.